Hello, everyone. My name is Ryan Nidek. I'm here for the Montgomery County Republican Club's Direct Line Live, here with former Governor of Virginia and former Senator George Allen and Dr. Jeremy Ackerman, a medical expert. Here we're going to talk about the COVID-19 vaccine today. We've had Dr. Ackerman on, more towards the beginning of the pandemic, and obviously we're in a much different place now with vaccines. And, a lot of hope on the horizon, but also, talk of new variants and that sort of thing. So, here to answer all your questions today. Governor Allen, if you want to get started, I'll turn it over to you.
All right. Well, thank you, Ryan. It's good to be with Dr. Ackerman again. You're in Atlanta, Georgia, at Georgia Tech, I assume. Is that correct, Doctor?
I'm a little complicated. I'm actually primarily faculty at Emory, but I also teach over at Georgia Tech as well. So
I'm sorry.
Good to remember some of the details.
Yeah. Well, thank you. At Emory. And early on in this last year, and maybe it was around this time last year, we were together discussing what we knew then, and we've learned a lot more since then. And your insight and information is, I think, very valuable and instructive to people. I find it interesting that as more and more, obviously, there's a great deal of optimism these days as more and more people get vaccinated, and that helps. There's still a lot of fear for some people. Others aren't as fearful about it. I found this Gallup poll interesting that just came out that young people were actually much more fearful than those over age 45, where we've seen that the preponderance of the deaths from COVID-19 are those over age 65. And there's a difference between Republicans and Democrats and independents as far as their fear. But we're not having you here, Dr. Ackerman, to be a political scientist. We're here to hear you as a medical scientist. So could you share with us your views of where we are now, the worries about these mutations or the variants, and whether or not the vaccines, from what you can discern, are going to be efficacious against whether it's the UK or South African or Brazil mutation or New York City mutations or variants from it, and any insight you think we all need to know.
Sure. Well, I think I should start by kind of mentioning a little bit about where we are within the healthcare community. For folks like myself who've been in emergency departments, we are now in well over a year of coming into work wearing all the PPE, the personal protective equipment that, and PPE used to be a word that only people who potentially were in these high risk situations would even know what that meant. And now pretty much everybody knows what PPE means. In hospitals like the one that I work at, although fortunately we're well down from our extremely high rates of having patients with COVID, we still have pretty large numbers. In fact, in this sort of trough that we're in right now, we're at levels of case rates that are higher than, say, we were early summer when we were concerned about how many cases we had and that we were seeing our second wave and all of that. So it's still something that's a little bit of a problem. At the same time, we have vaccines now, and nationwide, vaccination programs seem to be going pretty well. I believe we're national average is a little bit right around 20% complete vaccination rate, which is great, but it's nowhere near as high as we actually need to be. In states like Georgia, we're a great example. We are the worst in the country in terms of vaccination rate, and we only have about 13% of our population vaccinated. In order to get where I think we all want to be, this herd immunity, where we have so many people who have either had the disease or have been vaccinated against it, that even if one person gets the disease, it's unlikely that multiple other people will become sick as a result. We know that there's a magic number somewhere in the order of 70 to 80%, which we're just nowhere near at this point. The issue of the mutations is a little bit of a challenging one. And, at this point, I think there are about 7 distinct mutations that people are talking about There probably are more that have been identified in labs that we've just not seen in substantial numbers. And these are where there are genetic changes in the virus that for one reason or another spreads or otherwise becomes a more substantial amount of the virus that's out there. And this poses a number of different risks for us. There's a chance that a mutation may occur. That means that people that have previously had it are not immune. There's a chance that we could get a mutation that occurs that will make the vaccines that we've gotten less effective, or in a kind of worst case, not work at all. And the challenge of mutations is the more people who have the disease, the more likely it is, given that there's much more virus out there, that there'll be a mutation that's an important one that's able to kind of get ingrained into a population and start spreading. And our worst case would be that one of those mutations that sort of catches on is one that either is much more contagious, makes people much sicker, or that our previous protections against it just don't work. And what all that means is that as much as I've been vaccinated for several months, as much as it's tempting to go out and do everything that we used to do the same way, it still is appropriate to be taking precautions to minimize the risk of transmission, even for folks who are pretty sure you've had it, know you've had it, or know you've been vaccinated, because there is still some risk while there is a large amount of this virus out there that one of these other strains will catch on, and we'll find ourselves way behind the curve on whatever the new strain is. So I'd like to think our vaccination programs will continue. People who've maybe been a little bit concerned about the vaccination programs will see that people like me who've been vaccinated since I guess it's late December are doing fine and are not having problems. Hopefully we'll have some more scientific data regarding younger kids, because although they don't tend to get very sick from it, they do potentially bring the virus home. So I can't wait until both of my kids have been vaccinated. One of them's still too young and is ineligible right now. So unfortunately, I think we're looking still at months where we're going to need to be thinking about what kind of precautions we can take that are reasonable, that don't slow down business and other things that are important, allow people to get back to work. But I think things like wearing masks, being a little bit more conscientious about hand washing than as a country we probably have been before this pandemic, will still be things that will be important for us to be doing and important to be promoting from a public health standpoint.
Well, one of the things I heard, Dr. Ackerman, from other doctors is that these variants spread at an exponentially faster rate and overtake the previous virus strain. And then the question is how efficacious are these vaccinations, whether you've gotten Moderna or Pfizer or this J&J latest one. And then it's like a tip of the iceberg, the identified COVID cases, confirmed cases, that I've seen some research that seems credible to me, that there's 8 times as many people who've actually gotten COVID. And these are generally younger people, because everyone reacts differently. Everyone gets a different reaction from getting the vaccination. I've gotten the Moderna, that second shot, that second dose I got about a month ago. I said, this must be a dose for a bear. I was really aching and knocked down. After the first one, I was just kind of sleepy. Second one really hit me, which is the way it's supposed to work. Second dose is a stronger dose, supposedly. But but that gets to the whole point of herd immunity, is that we may be closer to herd immunity than we think, but we don't know. And then there's the question of whether or not this is more of an airborne rather than surface. And there's nothing wrong with washing your hands. It can't do any harm to disinfect counters, wash your hands, do all these sort of things. But it's interesting how the transmission in airplanes, because of the air quality in air handling, is less than say you're on a ship. And I don't know when people ever want to go on a cruise line for a while, but it's air handling on airplanes that makes it safer. So the more you can have air, like if you're outdoor dining, the better. What are your views on those different aspects of it?
Well, there's a whole lot of things to follow up on. So, you may be right in terms of a number of people who've had it, that we may actually be looking at a larger population that's actually had it and is therefore already immune. Although in terms of the whole population of the country, that still puts us as the number of people having had COVID is relatively low. And we will soon, if we haven't already, even with these larger estimates, have more people vaccinated than who actually got the original illness. So it may help us out. The scary thing with these variants, and you're right to note that some of these variants are much more contagious than the original strain and earlier strains. Every time there's a little change in the virus, it's going to change its behaviors a little bit. And the primary mutations that we've been tracking have been this protein that actually helps the virus get into cells in our body. And it's also the same protein that in most of the vaccines are targeting as how to help our immune systems identify this virus and help us fight it effectively. And that does raise the very real risk that the next mutation will somehow be one that alters enough of that protein so that our vaccines are just not effective. And potentially those who've previously had other strains, their bodies won't recognize these new strains. And that would just be a horrible combination. That's something that spreads more rapidly. And then everybody who thought they were protected doesn't have the level of protection that we thought. So it's a real risk, and that's part of that imperative that we kind of maintain our vigilance and our caution about this until we truly get to where we're not seeing large numbers of cases. The more active cases, the higher risk that we're going to get a mutation on top of a mutation and end up with something that's even nastier than what we started with. So, you know, there are some reasons to believe we might be a little closer to herd immunity, but until we get to that point and we're seeing the rate of new cases drop off and not seeing these upswings that we're getting, you know, I'm not ready to let down my guard quite yet. You know, in terms of the air handling issues, airplanes are fascinating in terms of air handling. You know, there's not very much air in a nice little aluminum and now titanium cylinder in the sky, but they pull that air in from the outside, pull it through a jet engine, you know, sterilize it, clear everything out, and recirculate it. And because it's a small space, the air has to be recycled very quickly and recirculated. And because of other things that we've known about air handling systems, we've got all sorts of filters and other great things in place in aircraft. And as much as many people worry about what they're going to get from the aircraft, you're right, the air handling systems, except for people that are kind of in your immediate, roughly 3 to 4 foot radius, there's not nearly as much risk as we typically would think about. Going back to your point about flu, this year's flu season has been absolutely amazing. Last I checked, in the state of Georgia, we had a total of, I think, 5 confirmed cases of flu.
Oh,
right?
5
Right. So like I literally can count on one hand how many cases of flu were documented in the entire state. And so, you know, part of raising that issue and that comparison with the flu and some of the issues around hand washing and surfaces, some of those things that we collectively are doing, forget about this pandemic. They are actually just good for maintaining our health in general. And you know, as much as I'm a doctor and I like having business, we get enough business from enough other things. But if we could have a flu season next year and the year after, where as our risk of flu goes up, people go, oh, we need to wipe down our surfaces, we need to clean our hands. Maybe we stop, as you know, I do like a good handshake, but you know, that's also one of those things, the fist bumps, the elbow bumps, that are becoming much more commonly accepted. From a public health standpoint, really are good ideas, and maybe things that help us over the next 5-10 years, if we kind of allow them to become a little bit more deeply ingrained, may actually save people's lives and keep people healthier beyond just this pandemic, which would be a great thing.
Yeah, nothing else, not get so sick. And, you can make fist bumps become stylish, so to speak. With it.
Absolutely.
Yeah.
Brought up a lot of different things. Well, I don't want to have everyone living in fear with it, but let's if worst case scenarios are going to have to be going through these various vaccinations being developed, which is this warp speed has been just fantastic, and the best thing for the economy really have been these vaccinations for people getting somewhat back to close to the new abnormal. Now, in best practices, interesting you say Georgia's been in my view, exemplary in many respects for opening businesses, as has been Texas and Florida and Tennessee and various South Dakota and other states. Now, being really low in vaccinations, interestingly, the state that's always been at the top in vaccinations from the start has been West Virginia, not Virginia, West, by God, Virginia. And what their governor did from the very start was he used all the local pharmacies, and pharmacies are accustomed to giving flu shots, shingles, vaccinations, tetanus, and so forth. And personally, I've ended up having to go to North Carolina at a Walgreens, which was just great. Signing up with them, get an appointment. They had them in 15-minute increments. As soon as I got my first scheduled one, they went to, here's your next one 4 weeks later. That date wasn't good, so just went to the next date. And it was friendly. It really was a model of doing it, whereas the state-run mass vaccinations have generally, from my perspective and others, it's just been a fiasco. They don't even, it's just really not well done. Now, in Georgia, because some places still are having a hard time with vaccinations, and some health systems, these are hospitals and doctors and so forth, will get around it. But I have found that the pharmacies have been the very best at doing this in an effective, well-organized way, not wasting a lot of time and not a ton of people standing around and so forth. Has Georgia not used pharmacies? Why has Georgia been so poor as far as getting shots in arms?
It's a little bit hard to tell with the information that's been publicly released. There are a couple of issues that are certainly striking. When you look at published statistics about vaccinations, we've got the vaccination rates, but then we also now have statistics available of the number of shots available versus the number of shots administered. And Georgia is very low on that list as well. One of the issues that's come up in Georgia is that people are refusing vaccination. And it's very tempting to put a political spin on it and go, oh, well, it's one group or another that doesn't trust the government or whatever else, whatever other reasons that unfortunately there are, as you pointed out, there are some political alignments that are somewhat predictive about whether people are willing to be vaccinated or not. But in Georgia, it's interesting. Health systems were the first place that vaccines were rolled out in an attempt to get all healthcare workers vaccinated.
Right.
And we had doctors and nurses all over this state that were refusing vaccination.
Hmm.
And I don't personally understand why that would be. If you understand the science of how vaccines work, yes, this is a new vaccine technology, but has been used for a very long time actually in animals, and has other predicates for being used in humans. A lot is known about this technology. It was just the first time that we picked a specific viral target to use this technology on. So when you have doctors and nurses around the state who are refusing, it should really not be a surprise that there are communities that those doctors and nurses come from, that folks who know even less about it are likely to be refusing vaccination. In terms of distribution of the vaccine, early on it was very clear to my eye, and again, without knowing the details on how things were working at the state level, my perceptions may not be true, but it seemed like we had an odd distribution where vaccine wasn't being distributed with consideration of where populations were. We're a state with a great many counties, and part of the initial push was essentially equal amounts to each county. But we have two counties that together have something like 60% of the population of the state, and giving those two counties the same amount of vaccine as every other county just doesn't follow the sniff test of it making much sense. I do like the idea of using pharmacies as a distribution point for vaccines, particularly when you get away from large population centers.
Right.
I think it's just more efficient to use that infrastructure. Unfortunately, two of the vaccines, because of their storage requirements with needing these ultra low temperatures, that became a little bit of a logistical problem of how you get the vaccines out, keep them cool and all of that. And I don't know if they had a really smart solution to that issue in West Virginia. Unfortunately, I think a lot of states
they probably used the Moderna that didn't need it to be 40 degrees colder than Antarctica.
Yeah. I think one of the challenges with the vaccine rollout is all the states were in a hurry to do a rollout, and there really had not been time for anybody to compare notes and figure out what worked, what didn't, and really come up with the best practices. While I hope we'll never find ourselves in a situation like this again, you've got to hope that smart people somewhere are kind of looking through and already working on the after action report, and going, okay, if we ever have to do this again, can we have a better plan? One of the things that was actually very striking once the vaccines were approved and we were in the kind of roll up to the vaccines actually be distributing out, multiple levels, whether it was government or within healthcare systems, when people would say, well, when is this happening? A line that I heard quite frequently was something along the lines of, well, we didn't have any warning. And many of us in watching Operation Warp Speed, were saying, well, we knew that we've got multiple vaccines in a pipeline, and we knew there was going to be a day when suddenly doses would be available. What do you mean we didn't know this was coming? Right? We've been waiting for this for, at that point, 9 months. And so I think in defense of some of those folks who were saying that, a lot of those efforts of those some people in planning the vaccine rollout, they were also the same people who were managing the healthcare crisis of our hospitals filling up, having so many sick and in some cases critically ill patients, that it may have felt to them like we had no warning, mostly because they were trying to put out other fires and then were handed this new problem. Again, I think there's a lot of lessons to be learned about how to do things better, should we ever have to do it in the future.
Well, I think it comes down to Dr. Ackerman, not the hospital, but the governance and the governor in particular in various states. And some were better prepared than others with it. And yeah, gosh, in Virginia, we have all these technology companies, and the portals kept, for signing in for registering, were all screwed up. And they went through about 3 iterations of portals just to get before they got it right. And in Virginia, at the same time, North Carolina partnered Walgreens, Virginia partnered with CVS, and CVS had their system based on Virginia's system, so theirs was just as screwed up as the state's Department of Health with it. And so I think it's really the government to distribute the government, how you distribute some within the healthcare system, with your Department of Health, your public health services, and with any of the private pharmacies. Some are very big, not just Walgreens and Rite Aid and CVS. And there's Walmart. Has pharmacies and others. So there's ways of doing it. The interesting thing, what you're saying about many healthcare workers didn't want to take the vaccine. Generally speaking, the people, again, this is generalizing. The people who are fearful of it are some that just don't trust the government, and there's good reasons why people don't trust the government. And then you have in the African American community the knowledge and remembrance of what was done at Tuskegee with experiments on Black people, which were just abhorrent. And so there's less support in the African American community. So smart thing to do is go to the churches and go straight into the community. The other thing is, again, it's governance. If you're giving some rural county the same amount as you're giving to Cobb County or DeKalb or Fulton, these big big population counties around Atlanta, it's just not aligning. It ought to be done population based with it. Now, I'm one, and I actually learned something. All of this, I'm one who would never get a flu shot because I got one back in the 1970s and got sick. Said the heck with it. Understanding how these vaccines are created, to me, is much better. It fakes the body, to build it up, to build up the immunities, as opposed to actually getting injected with the virus. So I think that as people, if they actually learn about it, they'll say, gosh, this makes sense, and it's not like the old flu shots with it. Ryan, do you have any comments as a young person in college that has not had, unfortunately, many in-person courses, unlike Liberty University and others that are private and not controlled by the government? Ryan, what question?
And we're hoping that Governor Northam will allow us to have in-person class next fall. But, to your point about Virginia's vaccine portal, I actually got vaccinated yesterday here down in Radford. I signed up on the portal, and it went from not hearing anything for months, being on the wait list, to all of a sudden getting 3 calls for different appointments this week. So, on to Dr. Ackerman's point about availability, but I think we're kind of hitting an inflection point here where it's going to be, before it was demand outpacing supply and, people going on the websites and refreshing. And now we're, supplies outpacing demand. And, you talked about 80% of the country needing to be vaccinated approximately, more or less, to get herd immunity. So that's about 260 million people. Do you sense, maybe a changing of the tune here as, more people get vaccinated? Do you think some of that hesitancy will go down, or what steps can we take to address the vaccine hesitancy so we can get everyone comfortable to get vaccinated?
I think that encouraging people who are in kind of public positions, using forums like this, to kind of just spread the word that this is really something that we need to do as a country. I think, you shared your story of Governor Allen, of getting the vaccine and the second dose kind of really getting you a little bit. I think sharing that and saying, look, I got it. I didn't feel good for 24 hours, and then I got better. And so that people at least know a little bit of what to expect, and know that other people are sharing that it's important to have done that. I will tell you, my vaccination experience was the opposite of what it was supposed to be. I got the first dose, and 6 hours later, I was sore, feeling feverish, didn't want to get out of bed, had 24 hours of misery with the first dose. And the second dose, I actually went home, went to sleep, woke up in the morning, and did a SWAT operation. And realized halfway through the operation that maybe I had been a little sore when we started, but was feeling a little bit better at the 24-hour mark. So everybody's experience is a little different.
Pfizer or Moderna?
I had the Pfizer.
Oh.
And my first, I got mine through Emory Healthcare, and so my first dose was kind of this assembly line thing in a mall that a closed mall that the university had bought. The second dose was actually done as a drive-through vaccination, where they had an old, I think, car dealership, and you lined up and you handed you cards and you signed things and you gave them your shoulder. And it was quite efficient. My parents they're now fully vaccinated. I think they were using earlier versions of the portals in Maryland, and they told me about how they got into this portal, and this portal wouldn't let them sign up because their address was wrong. But a county that they don't live in that had sent them an email that said they couldn't be vaccinated, then sent them an email and vaccinated them. I think there was a lot of confusion in a lot of places early on about how to make these portals work, and hopefully we're settling into more of a steady state where if you want the vaccine, you can have it. But I think many of us need to be reaching out a little bit more personally to people and encouraging people that we know who are not crazy about the idea, and kind of nudge them that it's the right thing to do.
Yeah, I agree. In fact, Virginia was so slow. I would have gotten my first shot just this last weekend if I waited for. I mean, there were 2 months behind if I waited on Virginia. Then our youngest, 23 today, just got the J&J single shot, and she was all reticent about it. I said, "Oh gosh, it's not bad. You'll live through it and all that." And what I think you're going to get, Ryan, to some extent, is she's going to work on a resort ranch out in Wyoming this summer. So they have visitors, generally city people, who want to go to a resort range out in Wyoming, and they're requiring everyone who works on that range, wranglers to people working as cooks, to be vaccinated. They want to quarantine them for a while when they get to a very rural area where range is. And I think you're going to get more and more employers requiring employees to be vaccinated. That gets a whole issue, but still, I think hopefully, Dr. Ryan, as more and more people say, "Well, I got it," and gosh, my 90 father-in-law, he gets it, and he had no effect whatsoever for his vaccination. So it affects everyone differently, but the point is, you feel like a brand new person when you're through it. It is such a peace of mind, especially for younger people in our family, and I think for everyone else. And I think it's insurance for it. And I think as more and more people say no, it doesn't cause you to lose hearing or whatever old wives' tales there are, more and more people feel comfortable getting it.
Yeah, absolutely. And I think that, I got the J&J shot as well. I think that Virginia's doing a lot more of them, but it's a relief to be one and done. And, hopefully for our Maryland GOP convention, we'll all be able to go and not, just not have to worry as much, right? I know it's not completely let the guard down, but, it's a bit of a sigh of relief. Dwight sent me, we've got some questions from viewers on, and this might be, Dr. Ackerman, a little bit out of your domain as a medical professional and more in Governor Allen's domain as, a former government official. But the idea of vaccine passports has been discussed a lot, kind of along the lines of, people requiring the vaccine. From the medical community's perspective, are you guys getting any talk on that, or, hearing anything about how that might end up being developed?
I've been part of some discussions with some of my colleagues about that. And, from the get-go, if that was an intention, we went around about getting the vaccine rollout a little bit wrong. We shouldn't have been issued little paper cards. We needed to have some sort of better tracking system and already be building that database and that infrastructure. I think this issue of the variants out there is sort of the big question mark. If we get a variant that is significantly different, or we end up being in a situation like unfortunately happens with the flu, where each year we get substantially different strains, then the vaccine that you got this year may not be kind of that pass that lets you kind of go through. The other thing that I worry about with a vaccine passport is actually related to something that we were seeing and still seeing a little bit, is people who are going online and getting these cards that say that they have a disability that prevents them from wearing a mask. There's essentially no disability that you can't wear a mask, that you should be out in public when there's a respiratory viral pandemic, right? So if you've got bad enough lung disease that you can't wear a mask, you are the highest of risk individuals, and you shouldn't be out and about. And yet there are a lot of people, and I ran into this with work that I do with scouts, where we said for our scout events, everybody's got to wear a mask, and people would come in and wave these cards. I have a disability, you're discriminating. And so I worry with a vaccine passport, unless it's something that we had, basic security and things like that, people are going to go, it's easier for me to buy a forgery than get the vaccine. And as soon as it becomes easy to get that fake passport, then there's sort of no point to it anymore. To a degree, I right now I sort of feel like the companies that it's important are going to ask you to show your little paper card. But I think most public gatherings, most public spaces are probably going to ask you, have you been vaccinated or not? And at least for right now, that seems to be where most people are going to leave it. And as we get to variants, as we discover, there may be some people who are vaccine non-responders. Whether you got the shot or not is less important than whether the shot you got works on what's out there and whether your body responded appropriately to the vaccine. In hiring folks to work in healthcare, there are a number of required vaccinations, and the ones that are most critical, the hospitals actually ask us to get immune serologies to make sure that our bodies have high enough levels of immune molecules so that we're actually immune and won't get sick and won't spread it. And I think we'll probably, if this is something that keeps on going for a while, in critical environments, the proof is going to be in the serology rather than proving you got the shot. But Governor, I'm curious to hear about kind of the policy, where you see that going, maybe politically.
I think somebody made a comment. It'll be very good, Dr. Ackerman. I like what you had to say from your angle against him. Somebody put in some comment. I saw there, Ryan, that they said, it'll be like fake IDs, for kids drinking drinking alcohol at an earlier age. and so forth. And yeah, they are paper, but heck, Medicare cards are paper too, and so security cards are paper. And they're telling people don't laminate them. It's going to smear the ink and this, that, and the other. I think there'll be too much blowback on it, and infringement and restriction on people's freedom. On the other hand, a business can ask their employees certain things for the safety of other workers and the safety of the workplace. And so, as a legalistic point of view, I think that employers should be able to tell their employees, this is going to be a requirement. It's for the safety of the business operations for other workers, and it also matters if you're going to try to attract business. There's going to be, I found it interesting. This was a pretty good example in Texas, which they love freedom in Texas, and they had their opening baseball game. And I'm not going to get into the All-Star game and the idiots moving it out of Atlanta, but they said you can have full stadium for the opening day for the Rangers in their new stadium. And so you had the people, oh, this is terrible. It's going to be a super spreader event. They said the Super Bowl would be one as well because they had 20,000 fans there and so forth. But I said, yeah, you can have it full, but I still think there's going to be people reticent. They're still going to be worried. There's still going to be, I don't know if it's 40%, 50% of the population that is still skittish, worried, paranoid, hypochondriac, whatever term you want to have, that are still not going to feel safe. And so for businesses, they want to make sure people are going to care more about sanitation, cleanliness, and safety, health safety than ever before. They didn't worry about it before. Now they will. So I think it's up to the businesses to decide. But I don't think the government should have such passports. I think one of the keys going forward is we need rapid testing. So people can be tested, not these ones that send it to a lab, cost tons of money. And I know we have to wrap up, but I think that there should be some much better testing. And then for those who test positive, they need to be quarantined. And you were talking about the folks who have respiratory problems and don't want to wear a mask. Those are the exact type of people you do want to be protecting and quarantining with it. But unless we have more accurate, rapid testing, instant testing, I've heard of being developed or soon to be approved tests that are just like home pregnancy tests that you can find out whether or not you have it. And it doesn't cost, it maybe costs a few dollars rather than $30 or $100. And I think that's the key for the future is testing. And regardless of what happens with any of these mutations or the variants in the future. So that's I know we have to wrap up soon, but that's at least of what needs to be done in the future, as well as stock PE and get more pharmaceuticals manufactured here in the United States, not being vulnerable to China and other unreliable, hostile regimes.
Dr. Ackerman, Governor Allen, thank you. Before we wrap up, I want to get Dr. Ackerman, if he has any final thoughts he'd like to leave us with, other than just, everyone go out and get vaccinated. All three of us got vaccinated. We're still alive, safe, So, yeah, Dr. Ackerman.
Yeah, no, definitely everybody needs to get vaccinated. Early on, we had talked a little bit about what we know works. I've now had over a year of taking care of super sick patients with COVID, in this building that's kind of my background, and doing high-risk procedures. We know that wearing the masks when you are absolutely religious about it and don't, let the mask down to scratch your nose, they work. I've gone 12 months. I was part of a study to track how healthcare workers get sick with COVID. And so every month or so, I got a COVID test that they didn't tell me the result of. They were doing the antibody tests. And the 2 days before I got my vaccine, I finally got all those results. And I gone the whole year without actually contracting COVID. So this is something that if you're super careful and taking precautions, we really are fully capable of preventing the spread. And, I did things with my police teams. I did things with some of the scout groups, with religious groups. This is not staying at home and doing nothing. This is being in the highest risk environments and then being in kind of normal environments that we all want to be in, but with a few extra precautions. So I think making sure that we stick with some of those until we have high enough levels of immunity and we're really seeing the case rates drop down really is mentally where we need to be right now.
Well,
Absolutely. Go ahead, Governor Allen.
I want to thank Dr. Ackerman for his perspectives and his knowledge and his own experiences. So we're not talking about, these are figures and data from CDC. This is Dr. Ackerman and obviously in a very high risk position. So thank you, by the way, for your bravery and courage and your service to fellow humans, obviously down there in Atlanta. And there's many others like you throughout the country, and we salute and thank all of them.
I appreciate that sentiment there. An awful lot of doctors, nurses, respiratory therapists, all sorts of folks that have been working hard for a good year on this.
Yeah, and it's not easy work. But so we thank you, Dr. Ackerman. Thank you for sharing your perspectives with us and also your salutary service. With that, Ryan, I'll let you do the wrap up.
Yep, we'll go ahead and wrap up. Thank you everyone for tuning in, and we'll see you all next week.
All right. Adios, y'all.
Hey, Goff, can you